in Illinois. They're classified, you have to be classified as low income, and you have to have one of the following areas here. So pregnant, be responsible for a child 18 years or younger, blind, disabled, or be 65 or older. So that is the criteria for Medicaid eligibility. The link that we've provided you here actually could walk a potential client through whether they would be eligible. So it asks them a series of questions, and this is on the benefits.gov website, and it will show them if they should consider applying for Medicaid if they potentially have not considered it in the past. So that's just another tool and resource for your clients. And that link is in the presentation, which you'll receive after Jen will send that out to the participants.
And
but
Angela,
this is your, yes.
Sorry, can I just jump in? Because what I just wanted to clarify something on the slide, and I'm not sure how we would word this differently, but since the Medicaid expansion and the passage of the ACA, you actually don't have to be both low income and have one of these conditions. It did expand coverage, so you can be a single adult with a certain percentage of the poverty level in terms of your income and still qualify. It used to be that you had to be low income and have one of these other categorical determinations, but with the passage of the ACA, single adults without children do qualify as long as they meet the low income requirement. But again, that benefits.gov website will walk you through that.
Correct. Thanks. Okay, so that's eligibility, client eligibility. That is going to be your first step.
Sorry, I just thought of one other thing, and I'm sure folks already know this, but I know we do have folks on the line that probably work with a lot of kids that are involved with the DCFS system. All children that are on awards of the state or former youth in care, 100% of them automatically become Medicaid eligible. So just wanted to make sure that we highlighted that as well.
What if they're not wards, but they're from low income families? Is that based on the family's income then?
Yes, yep, exactly.
Yep. Okay, can I ask one other question too?
Of course.
So when at intake, we do ask about insurance coverage, but I don't think we've been asking about it well enough to make a distinction between, so 80% of our families are probably low income, they're on our sliding scale, and we ask about coverage, but I don't think we've done a good job of making a distinction between Medicaid and ACA. And I think we're going to need to do that to get an accurate estimate, but I'm not sure how to ask the question, if that makes sense. Because I think our clients even are confused. Like if you say, do you have Medicaid coverage? If they have ACA coverage, I think they're looking at that as Medicaid. So how do I ask my client population accurately about their insurance coverage?
Yeah, that's a great question. Go ahead, Angela.
I was going to say, you know, asking them for their actual insurance card would be helpful. There's also, you know, Lindsay, we could send out, there's a tool that the state has that all providers can get access to. It's called, my gosh, Medi, is that right? I'm totally forgetting. Yeah, the Medi system, I totally just blanked out. But you could easily look in there too. And it's a state system that gives you access and shows you what coverage they might have. So there's a couple different ways.
Coverage, it won't show ACA, it only shows that's the Medicaid system.
Right, of course, yeah. And I think ACA, they also have, if that is more of, that is not, ACA is more of a commercial type coverage. It's not real. I mean, you can get it based on your income level, but again, they'll have an insurance card that's very clear one way or the other. So I think just simply asking for their insurance information would help you kind of tease out where that particular client might fall, whether it's commercial or Medicaid.
A couple of other clarifications and questions, both from the chat and from me. One, my guess is not all clients are going to be eager to share their information. And what if you're only working with the youth and you don't have a lot of contact with the parents? Anne is asking, how do we figure out what's the bar for low income relative to Medicaid? I know that
it's in this, yeah, it's in this link. If you click on this link, they also give you a income chart that would show you by number of households, people in the household, what the income levels need to be. So that is available on this link as well.
So could they use,
right?
Again, people don't always love to share their income information, so that's not always easy to get from your clients. Is there a proxy, like is free and reduced lunch a proxy?
I do not know the income levels for that, so I wouldn't be able to speak to that.
I don't know.
It sounds like many of you have sliding scales, so you must be asking for some kind of income level. Yeah, I don't know that there is a proxy. There's specific questions on that walk the client through on this benefits.gov. Again, because if they don't have coverage, they may be eligible and just not realize it too.
Thank you.
Yeah. Lindsay, did you have anything to add there?
No. Mm-mm.
All right, great questions. Keep them coming. Okay, so the second step, so we're gonna do our best to figure out our percentage of members that are clients that may be eligible for Medicaid or currently have Medicaid coverage or are part of the DCFS program, which means they are eligible for Medicaid. The second step is understanding your staff credentials. And I wanted to just illustrate for you here why the credentials matter. So what I have for you here, and Lindsay will get into this in a little bit, this is a fee schedule straight from HFS, so Health and Family Services. This is what all the Medicaid plans pay from, is the HFS fee schedules. And it lists out each service here. So if we look at this example of an assessment here, it's telling you what code to use. Then you'll see this column here related to modifiers. And as you get into billing, you'll understand modifiers even better. But in this specific example, I wanted to point out, so this one is modifier AH. AH means a master's prepared psychologist. If your team member is a master's prepared psychologist, and again, I'm going to show you some details, you would get paid $19.45 per quarter hour of service, okay? However, if you look down to the next one here, it's still the assessment, so same CPT code, it has a modifier of HP. So if I look over here on our modifier key, HP is a psychologist, a licensed clinical psychologist, and there's more to that than that says, but I just wanted it for illustrative purposes. So if you are a licensed clinical psychologist, you're going to get paid for a quarter hour of service $26.02. So you can see that based on the credentials, the actual fee schedule changes. And so that's why these staff credentials is so critical to understanding how your team is credentialed and what specific credentials they have. I believe Jen sent this out as well. This is a link right here to the administrative code. It is a bit of a read, but it goes into each of the specific credentials and what is necessary in order to be classified as each of these categories. So again, there's lots of, there's several different credentials listed here. So you're going to want to look at this credential document and then understand where your team members fit. So we've recommended a literal spreadsheet with your staff names, their specific credential information based on this document.
Angela,
So-
are you able to click through, because it is administrative code, which is sometimes not the easiest to read. But if you want to, so this is the particular code within the state. If you want to scroll up, Angela, the way that the state does this is they have things called licensed practitioners of the healing arts. If you look at number 3 down there that Angela's pointing to, that's the highest credential you can have according to the state. And it'll list under there the types of individuals that qualify as a licensed practitioner of the healing arts. So things like a physician, an advanced practice nurse, licensed clinical psychologist, an LCPC, and also a licensed clinical social worker, or sorry, licensed clinical social worker can also be classified as an LPHA. And that's important because there are certain services that you can only provide in the Medicaid program that are being supervised by an LPHA. So again, that's just the LPHA category. Then it goes down into under number 4,
QMHP, yeah.
the QMHP, what the credentials are to be that, and then finally a mental health professional. So it's very clear cut, and they have very specific examples of the types of education and certifications that you need under each of these categories. So I just wanted to make sure that you saw the document and you could see that it's fairly straightforward.
Yeah, it is
Just
very
really
straightforward, but
understand your staff, are they master's prepared? Have they written their licensure exam?
how many clinical hours they
how
have.
many hours
yeah.
of supervision do they have, et cetera, et cetera.
So you're going to want to classify your team members in these categories that are listed in this administrative rule.
Any questions on that?
Yeah, I can't see them because I'm sharing, but Jen, are there any specific questions related to credentials?
Just a question on where they can get a link to the rates per qualification.
Yeah, we're going
to get to that.
Yep.
Yeah, we're getting there. We're just building you up.
Yeah, I thought so.
Yeah. Okay. So again, this is in the presentation. This link is right there for you. This is just an example where we wanted to show you why those credentials are so important, and it really drives the rates. So again, using this administrative code, understanding your staff qualifications and credentials, and then classifying them according to this administrative code will help you as you move through this, this process.
And I would just mention, because this was something that I was getting myself frustrated with, the links only become hyperlinks when you're in screen, what do you call this?
Presentation mode.
Yeah, slideshow mode. So if you're in just the regular, looking at the whole document as one thing, it won't work. You have to have it in slideshow mode for the link to work. So
yeah, or you can just copy the link into your browser as well. So that should be good. Okay, Lindsay, you want to take them through determining the services?
yeah, so the 2 links that we have here. So I think we've mentioned in previous presentations that there is a billing guidelines document put out by the Illinois Association of Medicaid Health Plans, and that link is down here at the bottom. And this is just a screenshot that shows all the different mental health services that are Medicaid eligible with the appropriate code and those modifiers that Angela was showing you. Doesn't include rates because the manual doesn't include rates because they do change, and we want this to be as up to date as possible. So the rates you will get elsewhere, and we'll show you that in a sec. But I wanted to just take you to, because these are just obviously titles of services. What's really important is to go to the HFS. This is the Community Behavioral Services Provider Handbook, sorry. And they give you a very good description of all of these services. So if you want to just click on that for me, Angela.
Mm-hmm.
And it's the state thing, so I think it should be fine. Okay. And then if you scroll down here's the table. It's actually, I think we've said this before, for HFS documents, this is a fantastic manual compared to the ones we've seen for other providers. But Angela, if you want to go all the way to, actually, if you go back to the table of contents, and I can show the folks where to click to get to the service descriptions. Where it has, let's see, billing and service delivery requirements. So section 207, can you see it there? Yeah. So this is where, under this section, they describe all of these services in really thorough detail. So if you scroll down a little bit, Angela, you'll see the first one is integrated and assessment treatment planning. And it'll give you the description. And then it gives you just a thumbnail description of each of the services. And I'm sorry, this is probably making you nauseous as we scroll through this. And then at the very end of the document, I want to get to that part where they,
Yep.
I'm sorry.
Right here.
There we go. So scroll back up so we can see the actual, I think it's 208, right? Section 208. Yeah.
208.
So this is a really important part of the manual that you're going to want to take a look at, because it gives you the service and the description. And then up here, it's a Medicaid service. It can be provided by a community mental health center, a behavioral health center, or just an individual practitioner. So basically, this is what they call a Group A service. Anyone can provide it. Talks about the supervision and how it has to be done under the guidance of an LPHA, the medical necessity, and just some directions on staff qualifications. And then if you scroll down a little further, you can see at the bottom, unit of service, 15 minutes. It can be delivered in any of these three modes: video, phone, or face-to-face. Can you guys see my arrow, or is it just me seeing it?
No, you can't. They can't see your arrow. You have to.
I'm sorry. Here I am talking away. Angela, can you go
Yeah.
down to the second page, starting with HFS, to
Yep.
unit of service? There we go.
Yeah, right here.
And then the delivery mode, whether it's individual service, a family service, a group service. And then these staff qualifications, these are the types of providers or staff members within your organization that are allowed to provide this service or permitted to provide this service. And they go through each and every service in the same manner. So you can see individual counseling, you can see crisis intervention, you can see assertive community treatment, mobile crisis response. It goes through and does that for every service. And that's really important, because that's going to determine, again, not only your revenue potential, but how you want to register as a provider in Medicaid. Angela, can you go back to the PowerPoint now? Are there any questions on that? And again, the link is there.
I think we should talk about the integrated assessment and treatment plan that's required.
Good point. So in the Medicaid program for behavioral health services, there is a common required assessment and treatment planning tool. They use the IMCANS tool. Some of you may be familiar with that, other work that you do. But any individual that you want to provide service to, if you want to bill for that service, you have to complete an IATP and put together a treatment plan that's going to drive the rest of the services, whether it's, case targeted case management, counseling, group counseling, et cetera, et cetera. Everything starts with that IATP. It's a common instrument. It may not be the current assessment and treatment planning instrument you're using, but if you want to bill for Medicaid, you have to use the IMCANS tool on the HFS website. And we can send that link out as well, so you can see what that assessment tool looks like. But again, many of you probably are familiar with it.
And this assessment is a billable service. So you will be able to bill for providing this assessment or doing this assessment on your client.
Yeah, exactly. Okay, so let's go back to Group A, Group B. What you need to do is look at the list of services that you are currently providing and how it matches up with Medicaid billable services. The state divides mental health services up into 3 categories: Group A, Group B, Group C. They're divided based on the intensity of the service provided. So Group A services are sort of your bread and butter mental health services, things like counseling, assessment and counseling, whether it's therapy, group counseling, etc. And crisis intervention is in Group A. Group B gets into more intensive services, things like community support services, medication administration, targeted case management, things that require a little more higher credentialed providers, means that the individual probably has a more intensive diagnosis or a higher needs diagnosis. Those services can only be provided by what are called either behavioral health clinics or community-based mental health, community mental health centers. And that is important because I know many of you probably are providing targeted case management and community support services. And that determines how you're going to register an impact. So if you're just providing general counseling and assessments, you can just go in and register as individual providers under Group A. If you want to provide those higher level services like community support, targeted case management, et cetera, you will have to register as a behavioral health clinic, which requires a site visit and some other requirements to become licensed as a behavioral health clinic. And then finally, if you want to provide the highest level of services, which includes things like psychosocial rehabilitation and assertive community treatment, those are really services provided only to the very seriously mentally ill, like the schizophrenic population, many folks that have a behavioral health diagnosis and perhaps are experiencing homelessness, things like that. Those are only allowed to be provided by community mental health centers, which again is another level of certification that you would go through with the state. So again, understanding the services that you currently provide, or perhaps you're thinking about growing your service line that you would like to potentially provide in the future, match those up with what's in the handbook, and then look at whether you want to become a behavioral health clinic. There, in that handbook, talks about how to go about becoming a behavioral health clinic and the requirements. And it's all within that community behavioral services handbook. And I see, is there any document or handbook that walks potential BHC organizations through the steps? Yes, actually, if you go in that handbook, Angela, is there a way to go back to that and I can show Jean where to find that? And the state is contracted with the U of I as a TA provider to help providers go through the BHC registration process. If you go to the table of contents, Angela, sorry, go back up. And you'll see BHC enrollment, section 202.3, and then the approval process, 202.3.1. And then there's also information in there about CMHCs and if you're interested in that level of service provision. Okay. Any other questions? Again, it's a little bit of work, but it's as long as you're organized and know what services you're providing or want to provide, it's a fairly easy crosswalk to get through.
We provide some like comorbid with substance use.
Mm-hmm.
We're definitely like a level 1 outpatient.
Yes.
Like aftercare, that kind of thing. Is that different?
That is different. We can send you the link to the DASA, oh, not DASA, sorry, it's Super now, the Super Handbook. It is different. We're not going to cover that today. That is a separate certification process to become a DASA provider. I'm sorry, I keep saying DASA. Super provider. It's a different section in the administrative code. And we can send the link on how to become a super provider, and I can send you the handbook as well. Some of those services are definitely Medicaid billable though. And actually, if you want to go again on the right there, the Illinois Association of Medicaid Plans billing manual, there is also a section in there on substance use disorder services. And there is a nice chart that lays out the services that are Medicaid billable under the Medicaid program. And most level, if you're treating the ASAM level 1, those are all included. Again, if you have the right credentials, you have to have a CADC providing those services. Any other questions on this? Okay. We gave you the link directly to the Behavioral Health Services Handbook. So we've got the credentials. We know we got to find out who's credentialed in our staff. We're going to take a look at the list of services we provide and where they fit in the Medicaid program, like Group A or Group B. Next, we're going to start looking at how much do you get paid for each of those services. So the link on this page takes you to the HFS fee schedule homepage, and it lists all the different providers you can see there. And you just click on community mental health providers. And I don't think, unfortunately, for whatever reason, getting back to Super is not on there. You have no idea how difficult it has been to find the Super rates, but that's a conversation for another day. I don't know why they don't include them on there. So here we have the fee schedule, and you can see this is obviously just a screenshot. All the services that we just talked about, your IATP, these are your Group A services, your IATP, your crisis intervention, your therapy and counseling services, and it goes down through all the Group B and Group C services. It also includes a chart of all the modifiers, so you don't have to say, well, what the heck's an HN modifier versus an HO modifier, et cetera, et cetera. It does include that. And it also includes a chart of allowable locations of services. I suspect most of you folks are doing these, in the office or at your organization, but it does have other locations of service that you can provide these services on if you are allowed to do so. So you can see just in terms of how you read this fee schedule, this is obviously the service description. This is the HCPCS code, which are the national coding standards that are used across the program, across all billing, Medicaid, or all healthcare billing. So Medicare, Medicaid, commercial, everybody uses the same codes. So H2000 is what we call a HCPCS code. Then you can see the modifier that Angela mentioned, and each of these represents, in this case, HN is the MHP, a mental health professional. The unit of service is a quarter hour. And then your billable rate would be $17.96. One of the things that we are trying to get clarity on is, you'll see over that middle column that says add-on. There were add-ons added because of COVID, and I'm not sure if this is the add-on that they're describing here. They don't have any clarification. So we're trying to find out from the state if this is a COVID add-on, which means that you probably, if you want to be conservative, don't want to use this in your revenue projections, because that will go away once the public health emergency goes away. So just to be on the conservative side, I would say stick with your, just the state max here. But we'll find that out and let Jennifer know once we get clarity on that.
Right.
So that's sorry, Jennifer, did you want to ask a question?
Oh, I just said great. I wonder if it's worth sort of, because one of the things that Lindsay and Angela did is actually build you guys a spreadsheet that you could use to figure this out for your individual organizations, like sort of step by step, because it's a lot to take in. So I wonder if just in the interest of time, it's worth sending that. I haven't sent it out yet, but I'm going to send it now.
Oh, okay. Yeah, I
is
think
it-
that's probably next on our slide deck, is it not, Angela?
Yep. All right. So it's coming to your email. Try not to get distracted by the other emails in there. I know it's hard. I'm really bad.
Okay, and I did want to just address Anne's question.
Yes.
I think it was about BHCs, behavioral health clinics, and site visits. You do not have to be accredited by an accreditation agency like CARF or anything. I mean, that's always a great thing to strive for. This is really just your certification from the state that you meet all the regulatory requirements to be a behavioral health clinic. So it's different and separate from accreditation. Hopefully that answers the question, but pop in if you need more information. Okay, so this is what we're gonna do with you guys now. So let's look at, and I'm just gonna walk you through how we did this before we get to the spreadsheet. So you remember Angela's example of the psychological assessment. So we have a, clinic XYZ. They have a psychologist who's master's prepared. They provide an average of 4 half-hour assessments per day, which equates to, if you look at a quarter hour as a service unit, that's going to be 8 units of service that they're providing every day. And they know at Clinic XYZ that 50% of the clients that Susie Jones, the psychologist, is seeing are Medicaid eligible. So this is how we built the spreadsheet. We know that Susie Jones can bill $19.45 for every quarter hour of service. So that's $19.45 times 8 units of service every day, which comes to $155.60 per day that she can bill. But we're going to cut that in half because only 50% of her clients are Medicaid. So that brings us to $77.80 per day. And she provides 25 clinic days a month. So we're going to multiply that by 25 and get $19.45 a month times 12 months. And we know for that staff member for that service, she's going to be able to bring in you're going to be able to bill $23,340 annually. Okay, so that's how we built the spreadsheet. So let's pull up the spreadsheet. Angela, if you can give me permission. Let me see if I can pull it up. There we go. All right, so you'll see our example up here that we just walked through, okay? So now if we look at your individual organizations, you in this column, you can put the name of your staff member and whatever credential they may have. So in this case, it's, Bob Jones, who is an LPHA or a QMHP. They're the same in terms of billing. They're providing therapy service individual, they're applying group therapy, they're providing integrated assessment and treatment. So this is just a very simple example. But what you're going to want to do is take Bob Jones and list out all the services that Bob Jones is providing with, look at the fee schedule. You don't probably exactly need the HIT codes for the purposes of the spreadsheet, but we just included them here. What the billable unit is, and then estimate for Bob Jones how many quarter-hour units of that service is he providing per week. So in this case, we put 8, and we could put, maybe he's doing 4 group counseling, and he's doing 6 intakes a week. Okay, and then you've got another staff member who's only at the MHP level, and you're going to do the same thing. So each staff member you're going to list in this staff column here. You're going to put the services that they're providing. most of the billable units are quarter hour. And then you're just going to estimate based on their schedule or their client caseload, whatever makes the most sense for you. Do an estimate of how many units of that service they provide a week. And then in this, so let's say the MHP is doing, I don't know, 20 counseling sessions, 5 group counseling, and also doing 6 IATPs a week. The next thing you're going to want to do is, we talked earlier about thinking about what percentage of your clients you think are Medicaid, either covered by Medicaid or could be eligible for Medicaid, and they just need to apply. And you're just going to put that percentage in here, and you can change this. It's completely changeable. So let's say we want to do 50. Let's just make these 50. And you can, obviously go up or down depending on, if you have someone that's working with only youth and care, it's going to be 100%. You can put 100% in there. And the spreadsheet is developed to, calculate based on that. So we know if you saw 8 units of service at 50%, that equates to 4 units a week, similar to up here, right? You got to cut it in half because only 50% of those are actually billable. And again, if we made this 25, it's automatically going to change that to 2. Make sense? And I cannot see the chat thing anymore.
Yeah, I'm monitoring it. I'm going to pop out in 2 minutes, but Laura's here and she can monitor.
Perfect. And so you can see that the calculation in this is just taking the number of units divided by the percentage of clients that are Medicaid, and it's going to give you those Medicaid billable units a week. And then in this column, the formula is just going to take, we used 48 weeks. We assumed a 52-week year and 4 weeks, either 2 weeks vacation and then sick days and et cetera, et cetera. So we used a 48-week year. You can make that weeks anytime, any number you want. So if Bob Jones is doing 4 billable units a week times 48 weeks, here's what Bob Jones gets paid per billable unit. That's right off the fee schedule. And you can see that it's going to give you, for that particular service, based on, the volume of service delivery he's providing, that's going to have a 3661.44 revenue potential. So you just have to, it's a bit tedious, I'll admit. But, once you get your staff credentials down and the services that you're providing down, you can just copy the formulas, or, if you have someone in your finance team who's more adept at Excel, and just kind of play around with calculating that revenue based on volume of services, et cetera.
And I would just add that this billable unit is what gets most people tripped up, because it's just not, doesn't appear logical in some cases, but you have to convert everything into billable units based on this quarter hour calculation. Yeah, so that's where we see most people.
Yeah, we've been trying to get HFS off quarter hour billable units for a while, and I don't know why. If there's some reason they have to be that way, but it is kind of a pain. So you do have to kind of convert. If you're doing an hour therapy session, that's 4 units. So that does trip people up. Thanks for that, Angela. Yeah. Any other questions on this? Does it make sense? Mm-hmm. I'm getting some nods. I like the video thing. This is really helpful. I appreciate it, because I can see if people are going, I have no idea what this person's talking about. Thank you, Jean. I appreciate the thumbs up.
Yeah, okay. I think it makes a lot of sense.
Okay,
this is really helpful.
Okay, well, I'm glad to hear it.
One question we had is, I know that obviously not all claims go through and get processed. Is there sort of an average that we can use of what % of submitted claims actually get paid?
Boy, that's an interesting question. It will really depend on, I mean, there's don't get paid because you didn't have the appropriate medical necessity or documentation versus don't get paid because you've got some issues with your claim submission process. Angela, you probably have a little more sense on the claim side. Gosh, I don't know how to answer that.
Yeah, I mean, no, I think there's just such a variety of potential denials. You have 180 days to fix your denials, though. So from your time of service. So, you know, there's very few that can't be resolved, I would say, but they do take that diligence. You know, some of the ones that can't necessarily be resolved are eligibility. So if the member wasn't eligible at the time of service, you know, those have little to no recourse. But if, but some of the other ones, I would say, outside of, I would say eligibility are difficult to have recourse to, and timely filing. Because if you don't submit within the timely filing deadline, there is no other option. So I don't think there's a standard percentage. Again, it just does depend on your diligence for your intake process and your diligence for your reconciliation process, meaning tracking what is being paid and what is not being paid, and then taking the proper recourse to resolve those. But I'm not familiar with any standard percentage of denied claims.
So I mean, in terms of like, what is best case scenario for what percent, realistically, you know, what percent of claims, I get it, it all has to do with how well you do your job in terms of submitting things and verifying eligibility, that kind of thing. But I mean, I'm guessing it's highly unlikely that 100% of anyone's claims actually ever completely get paid. Is 95% realistic? Is it 75%? Is there any, you know, because if we're trying to do a math problem here, and if you're, you know, we don't want to base it on 100% likelihood that these claims are all going to get paid.
Yeah, I mean, it varies so much between providers and between MCOs. I just don't think Lindsay and I have that number for you.
Okay.
To give you as a, but similar to how you did your Medicaid percent, you could play with, you know, add another percentage to that calculation that you could play with as well. You know, this is given that 90% of our claims go, you know, are adjudicated and paid.
Yeah.
So we just add another column for that calculation off of your annual revenue.
Okay, this might be a really stupid question, but if you have all your ducks in a row in terms of checking eligibility and you do everything you're supposed to do, does it ever happen that the Medicaid system, because of state funds or whatever, doesn't pay their bills and you have to write it off as bad debt?
No. You are not getting paid by the state. You are actually going to get paid by the managed care organization. So the Meridian, the Blue Cross, the Aetnas, and they have contractual requirements to pay, you know, clean adjudicated claims within a certain time frame. So even if the state is behind on their bills and is not paying the MCO still has a requirement to pay you.
Okay.
So you are protected in that sense. Yeah.
All right.
Good question though, because we are in the state of Illinois. So, but I would say too that, as Angela said, if you have a solid process in place to make sure you're checking eligibility and you're filing timely and you're doing that reconciliation. So if there's no doubt you're going to get denials. It just is a matter of course, and it's, either just silly input errors, or sometimes the MCOs have systemic problems that they're rejecting things for whatever reason. But if you do follow up, you've got the 6 months to work that process. You should be pretty good about capturing all that revenue. And if you do have, ongoing denial issues, Sarah's on the line. ICOI does have a a seat at the table. There's monthly billing meetings with all the providers and all the MCOs. So if you have difficulties with a particular issue with a particular MCO, you can bring it to those billing meetings for resolution. And there's also the state provider complaint portal too. So there's lots of recourse there as well.
Lindsay, do you want to give me back the ball? I think we're down to just 3 minutes here.
I don't know how to do, oh yeah, stop share, there we go.
Okay.
All right, it's all yours.